Hello, I'm Rhonda Gooden, Communications Manager with AARP Mississippi. Thank you for joining us today for Prepare to Care, Creating a Plan. AARP Mississippi is dedicated to providing information and resources to Mississippi's more than 400,000 family caregivers. I'm happy to introduce Dr. Sunny Fridge, who will facilitate our discussion. Dr. Sunny is an AARP Mississippi communications volunteer. She is co-author of the book, Voice of Hope, Inspiring Untold Stories of Caregivers. She is a longtime journalism educator and John Maxwell certified coach. Dr. Sunny is also an award-winning Toastmaster and broadcast professional. Welcome, Dr. Sunny.
Thank you, Rhonda. It's a pleasure to be here. Again, thank you and welcome. My name again is Dr. Sunny Fridge, and yes, I am a proud virtual communications volunteer with AARP Mississippi. Thank you for joining us for this virtual event. Today, we are discussing Prepare to Care, Creating a Plan. It was former First Lady Rosalynn Carter who said, "There are only 4 kinds of people in the world: those who have been caregivers, those who are currently caregivers, those who will be caregivers, and those who will need caregivers." Today, I'll share some important information to support family caregivers. And during this session, we will share a framework to help you make plans to care for family members, neighbors, and friends. So let's get started. You'll learn 5 steps to create a caregiving plan. You'll get special considerations that were taken during the pandemic and now the next new normal. How to connect with other family caregivers to share tips and information. Learn about resources available to you. Caring for a family member or close friend is one of the most important roles any of us will play. It may start with driving your loved one to get groceries, going to the doctor. As time goes by, you may find yourself taking more time off from work, preparing meals or handling bills. No matter where you are in the journey of family caregiving, just beginning to anticipate a need, helping to coordinate a big move, or taking care of a family member full time. Having a good framework to help guide both you and your loved one will make the process easier. To help you get a picture of today's family caregiver, consider the following questions. Think about if any of the following is true for you now or at any time in the past. Do you help a loved one with household tasks such as cleaning, laundry, or yard work? Do you help a loved one with medications? Regularly cook or provide food for a loved one? How about drive to doctor's appointments, make shopping trips, or run other errands? Help with a loved one's finances or pay their bills? Provide emotional support and companionship. Communicate with health professionals and coordinate healthcare? Caregiving may be one of the most important roles you will take on in life. AARP's founder, Dr. Ethel Percy Andrus, was a caregiver for her parents. In fact, she left her job to care for her mother. She said, "It is only in the giving of oneself to others that we truly live. The human contribution is the essential ingredient." Dr. Andrus was an educator, and her passion was to help older Americans lead lives of independence, dignity, and purpose. She founded the National Retired Teachers Association, NRTA, in 1947, and later AARP in 1958. Caregiving is in AARP's DNA. AARP supports family caregivers and their loved ones, both directly through programs and online resources, and more indirectly through state and federal advocacy. Are you prepared to be a caregiver? Let's take a minute for a short exercise. For every task I say, imagine someone tossing you one of the tennis balls in this picture. And when I say these statements, I will say mom or dad, but I encourage you to think about the person you're caring for. Take mom or dad to medical appointments. Pick up a prescription. Organize and help ensure mom takes her medication. Call the insurance company. Shop for groceries. Cook meals. Mow mom's lawn. Do laundry and clean dad's house. Bathe and dress mom. Go to work. Pick up the kids from soccer. Pay mom's bills. Take kids to school. Take mom to the beauty shop. Change mom's bandage 3 times a day. How did that feel? We know that caregivers juggle many tasks. How many balls are you able to juggle? Sometimes it might feel kind of like this picture. Now, here are some facts about caregiving which show it really affects everyone. Family caregivers provide the majority of long-term care in the US. The average family caregiver is a 49-year-old woman who works 35 hours a week and provides almost 25 hours of care per week. More than 48 million family caregivers, including 470,000 in Mississippi, each year provide care for aging parents, spouses, siblings, aunts, uncles, friends, or other loved ones. Caregiving affects the whole family. Men are now almost as likely to say they are family caregivers as women are. 40% of men, 60% of women, and even 24% of younger Americans ages 18 to 34 say they are family caregivers. So today, I'm going to share practical information to help you care for your loved one while also caring for yourself. We'll break this down into 5 steps. Start the conversation, form your team, make a plan, find support, care for yourself. According to the Centers for Disease Control and Prevention, older adults and individuals with chronic health conditions are at a higher risk of serious illness from the coronavirus. Many of the people in the US who have died from COVID-19 have been in their 70s, 80s, even 90s, according to the CDC. This is why we are all still needing to follow the CDC guidelines. Many of these vulnerable individuals have at one time lived in communities where diseases spread quickly, such as nursing homes or assisted living facilities. While nursing homes and assisted living facilities are a critical point of focus, many individuals who need care currently live in their own homes and could be feeling very isolated and anxious about how they can stay healthy and safe. All of these issues can cause more stress on family caregivers. So step number 1, start the conversation. Often families avoid discussions about the future simply because they don't want to think about changes in the lives of the people that they love the most. Sometimes avoiding the topic can be due to cultural reasons as well. Many people wait until a crisis occurs before they talk about their values and preferences, wishes for healthcare, or details about their finances. It's never easy to bring up what you think will be an uncomfortable topic. However, a lot of uncertainty can be avoided if you talk with your loved one before a crisis occurs. It is easy to put off these conversations because they can be difficult. Plus, we're busy, but you may be surprised to find out that your loved one has been meaning to have the talk too. Before you start the conversation, here are some things to consider. Look for an opening. When raising the topic of future care, you might find it helpful to reference an article you just read or something you saw in the news to break the ice. For example, you might say, I'm starting to think about estate planning. Do you have any advice? Or, I just read an article about gathering all your important papers. Sometime, can you show me where yours are and what you'd like us to do in just in case? Try not to anticipate what your loved one might say or how they will react. Just get the conversation started. Be open. Express your love and concern, and most importantly, listen. Keep in mind that the conversation will likely take place over time. Next, respect your loved one's wishes. Make sure your loved one is participating in the conversation as much as possible. It's important to center your caregiving plan on the wishes of the person receiving the care. Where do they want to live? How do they want to handle their finances? Size up the situation. Once you get the conversation going, evaluate what you're hearing. Understanding your loved one's priorities, where they want to live, and the nature of their care will help determine the next steps. Money can be a particularly sensitive subject to talk about, but it is often at the heart of many decisions you will make with your loved one. You need to consider how you're going to pay for housing, healthcare, and other expenses, groceries, medications, transportation. Ask your loved one to review their bank accounts, investments, insurance coverage, and other relevant finances, assets, or income that can be used to cover these costs. Find out whether they have long-term care insurance, should they need it. To help you with this task, AARP has created the AARP Caregiving Financial Workbook, a practical guide focused on health, housing, and money management for family caregivers. Each set of worksheets is designed for caregivers to capture the essential information they need to manage the complex responsibilities of caregiving. There is also a workbook available specific to veteran and military family caregivers, as well as versions in additional languages. You can find links for these resources in the comments. You may find that your loved one's initial response to attempting to start the conversation is something like, "I just don't want to talk about it." Keep in mind that some people are private by nature. Sometimes it's difficult for someone to admit they need help, and as a result, you may encounter some resistance. If your first conversation doesn't go well, try again. If you're still running into difficulty, try asking a trusted family member, a friend, doctor, or faith leader to share your concerns. After you start the conversation, step 2, form your team. Caring for a family member or a friend can be too big of a job for one person. Trying to do everything yourself may lead to burnout and problems with your own health and well-being. It's important to form a larger network of family and friends and tap into community resources to share the load. Your loved one can help you identify willing team members, such as neighbors or friends from the faith community that you may not have thought of otherwise. Look for team members who live nearby. Proximity has its advantages, such as stopping over to see your loved one, driving him or her to a doctor's appointment, or cooking a meal. Just because someone doesn't live nearby or have huge blocks of free time doesn't mean they can't pitch in. Family or friends living at a distance can help with tasks such as coordinating meals, bill paying, or financial assistance. Look for team members who can help with simple tasks. Don't be hesitant to ask others for help. Some people may need only a little encouragement to take on a task, and they're glad when you ask them for help. Look for team members who will share their talents. Leverage the talents and strengths of your team. For example, the computer whiz in the family could set up an online calendar for coordinating meals or chores. And someone who loves to garden might be willing to help out with your loved one's yard. Remember, your loved one can help identify team members, such as neighbors or friends from their faith community, that you may not have considered. Here are some more considerations about building and supporting your team. Determine the number of team members. Both quantity and quality are important to think about when building your team. While having a large caregiving team can be helpful, too many people might be difficult to manage. Make sure everyone on the team is clear about their responsibilities. They should be supportive and willing to lend a hand to you and your loved one. Assign roles and responsibilities. Everyone has something to contribute. Play to each person's strength and be clear on what's needed and expected. Focus on the care recipient. The key and often overlooked participant in the conversation is the person who may need the care. Barring mental or physical incapacity or other extraordinary circumstances, the person receiving the care should play a significant role in determining who should be on the team and what needs to be done. Step 3, make a plan. Now that you have a team filled with willing caregivers, it's time to start building out a plan and designating responsibilities. Always make sure your plans are being made with the person you are caring for at the center of the discussion. The plan doesn't have to be extensive or fancy. You can never anticipate every detail or scenario. The plan should include immediate needs as well as plans for the future. Keep in mind that the options for addressing needs will depend on finances, the willingness of your support team, and the resources available in your community. Part of making a plan is to hold a team meeting. A family or team meeting is one way to help you get things organized and ensure all of your team members are on the same page when it comes to making and keeping to the plan. First, meet with your caregiving team. This may take place face-to-face, over a conference call, or through a series of emails. Determine what works best for all of you. Set up a system for future communications with the team. Next, assess the goals and needs of your caregiving plan. Remember, this doesn't have to be extensive or fancy, as you can't anticipate every detail or scenario. Just try to include immediate needs and broader plans for the future. After you determine your goals, delegate responsibilities. It's time to figure out who will do what. Make sure you determine what tasks everyone is comfortable performing. Also, be sure to ask your team members about their preferences. Be open to modifications as the situation and team members' ability to help may change. How your loved one's needs unfold may differ from what you expected. AARP's Family Caregiving Guide offers assistance to help you during your caregiving journey. You can find a link to this resource in the comments. Here are some helpful tips to remember as you make a plan during your team meeting. Include the person who will receive the care. The team member who will receive the care should play a significant role in talking about and assigning roles and tasks to the extent possible. For example, even if one child is an accountant, an older parent may feel more comfortable having another child look after their financial affairs. Communicate. Try to keep everyone informed of the plan, especially as things change. Make sure that everyone knows about the discussion ahead of time so there are no surprises or hurt feelings. Take notes. One team member should take notes and write a brief summary of what was decided. A written summary of the plan helps ensure that the wishes and needs of your loved one have been considered and included. Step 4, find support. If you've come to realize that the scope of care needed for your loved one is beyond what you or your team can provide, it's okay to reach out for extra support. There are a number of ways you can obtain the help you need. There are many types of community resources that may be able to provide support. Your local agency on aging can help connect you to a variety of support services, such as home delivered meals, transportation, adult daycare, care management, and more. Your local agency on aging also can answer questions about which resources are free and which may have a cost. You also can check into services offered in your community through the Elder Care Locator. The Elder Care Locator is a public service of the U.S. Administration on Aging. It connects caregivers to local services and support. Consult a professional. Oftentimes, your loved one's needs can be complex, especially when health, emotional, and financial issues are at play. A trained social worker or nurse can help you sort things out, determine what is needed, find services, and arrange care. Again, the Elder Care Locator is a great resource to find such professionals. I encourage you to highlight this resource when you get the book. It can also help you connect to professionals and other services in your community. A link will be provided in the comments. Teams often need outside support, so here are some more support ideas about some of the most common needs. Hire help. If you see that your loved one needs help with daily activities, try exploring home care options. Some home care workers do household tasks, such as cleaning and meal preparation, while others do more personal care tasks, such as bathing and dressing. Your local agency on aging can help you identify and connect with the appropriate services. Secure their safety. To help your loved one be safe and comfortable in their home, try incorporating handrails, grab bars, night lights, or adjustable shower seats. Some things such as installing grab bars may be best left to a professional. You can also check out AARP's Home Fit Guide at aarp.org/home fit for a whole range of solutions. You can find the link in the comments. The guide provides tips, suggestions, worksheets, and resources to make a home a lifelong home. Explore housing options. A variety of housing with supportive services may be available in your community. Begin by making a list of criteria, such as location, group dining, laundry service, and more. Once you determine the criteria you need, visit several facilities and be sure to talk to residents and their families. For more information on housing options, go online and visit AARP's Caregiving Resource Center. The web address is www.aarp.org/caregiving. Support groups can also be helpful in navigating available resources. AARP has a Facebook group for caregivers. It's called the AARP Family Caregivers Discussion Group. And it also has online message boards on aarp.org. The link will be in the comments. There's also information through Medicare, medicare.gov/nursing home compare. Step number 5, care for yourself. Don't overlook the impact of caregiving on you. Pay attention to your health and well-being. The best way to ensure you have the energy to care for a loved one is to take care of yourself. Here are some tips for caring for yourself. Tap into resources. Social workers, nurses, and other professionals can guide you through care options and help monitor the care if you don't live nearby. Use technology. Personal emergency response systems, remote monitoring devices, and mobile apps can help you coordinate care. Ask your employer. Some employers offer benefits or services to support family caregivers. Review finances. It's important to calculate your caregiving-related expenses and account for them in your personal budget. Here are some additional tips for caring for yourself. Talk to your doctor. Let them know that you're a caregiver and discuss ways to manage stress. Advocate for you. The Caregiver Advise, Record, Enable, or CARE Act has passed in many states, including Mississippi. You should consult with your loved one's doctor for training if you're expected to do complex medical tasks at home. Take advantage of caregiving services and support. Services and support groups can help you throughout your caregiving journey. And take a break. Make time for exercise, sleep, healthy eating, and staying connected with friends. AARP offers a variety of online information, resources, in-person events, and self-paced learning, all for family caregivers. I want to be sure to mention several resources. AARP's Caregiving Resource Center. That's the central hub for all things caregiving at AARP. And you can find the latest articles, tips, and advice. And that's where you will also go to find the Family Caregiving Guide with downloadable checklists for when you need to update or revise your caregiving plan. In addition, there's a toll-free resource line, 1-877-333-5885. The hotline is open Monday to Friday, 6 a.m. to 10 p.m. Central Time, and Saturday, 8 a.m. to 4 p.m. Central Time. You can also call 1-888-971-2013 in Spanish. Learn.aarp.org. You can visit this center and this site to learn about upcoming events and to explore interactive educational videos and webinars on caregiving. Again, that's learn.aarp.org. I hope you enjoyed this presentation. We covered a lot, including learning 5 steps to create a caregiving plan. Start the conversation, form your team, make a plan, find support, care for yourself. We also shared many ideas about resources available to you to continue your learning on this topic. So make sure you check out AARP's caregiving resources and the AARP Family Caregiving Guide at www.aarp.org/caregiving. I hope you enjoyed today's virtual caregiving presentation and hope that the information and resources will be of value to you. It's important to prepare for our loved ones' future and our own longevity so that we can live the best life possible. Keep in touch with us. We've included our contact information here. And feel free to please reach out to us with any questions or comments. Best wishes on your caregiving journey. I'm Dr. Sunny Fridge, a volunteer with AARP Mississippi. Again, thanks for joining us.